Developing tonight, the Zika front lines. The CDC issued its first ever domestic travel warning for the virus this week. It warns pregnant women and their partners to avoid the Wynwood neighborhood of Miami, Florida. So far, at least 15 people in that area have been infected through local mosquitoes. And when we first spoke to a local specialist about this, he suspected that the virus would reach the southern United States. But could it ever land here? News 4's Jen Shantz is taking a look. Jen?
Well, Jackie, Dr. Bruce Rogers says rest assured the mosquitoes that carry the Zika virus don't live this far north, so a widespread epidemic here would be rare. But given the spread of this virus, he's telling patients to take extra precautions.
Health officials are working from above to try and combat the Zika virus in South Florida. A Miami neighborhood has become ground zero for the virus after a slew of local infections. The CDC is advising pregnant women and their partners to avoid the area. But Director of Maternal Fetal Medicine for Catholic Health, Dr. Bruce Rogers, is telling his patients to take it one step further.
My own personal recommendations, I advise the pregnant women not to travel to South Florida.
Dr. Rogers, as well as the CDC, is also asking women to delay trying to get pregnant for 8 weeks once returning from an endemic area. I first spoke to Dr. Rogers in February when the first sexually transmitted case of Zika was discovered in Texas. He studied fetal diseases for years, but says the Zika is somewhat unique in that it does little to the mother. But back in February, the link between Zika and birth defects was still being studied.
And the virus has now been recovered from central nervous system tissue, placentas, miscarriages. So the evidence that the Zika virus can infect the unborn child and result in multiple adverse outcomes, the most prevalent of which is microcephaly now, I think is pretty fairly established.
Because of Western New York's location and climate, we're not likely to see a large outbreak here unless Western New Yorkers travel to endemic areas and bring the disease back with them. The NIH is currently working on the first Zika vaccine, but health officials warn the research is dependent on federal money that hasn't arrived yet.
Now, 80 healthy volunteers are involved in that NIH study. If things go well, 5,000 more could be added for phase 2. Dr. Rogers says developing a vaccine, though, could take several years. Today, Senate Democrats urged Republican leaders to call Congress back into session to okay emergency Zika funding. Live in the newsroom, Jen Shantz, News 4 at 6.